Bismillah walhamdulillah wassalatu wassalamu ala rasulillah amma ba'd. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another episode of Sending the Community with me, Hafiz Muhammad Umar. And today's show is a pre-record, and I am delighted to be joined by some amazing guests. In today's show we are going to be talking about the Hatters Health Network. It's a primary care based here in Luton, and I have some amazing guests with me. And before I go to our guests, I will ask Raz to introduce himself. Raz?
Hi, my name is Muhammad Sadri.
Thank you very much, Raz. And Jane?
Hello, I'm Jane Lee. I'm social prescriber at Hatters Health Primary Care. Good to be here.
And great to have you with us, Jane. And Juliet, please.
Hi, my name's Juliet Edwards. I'm lead social prescriber at Hatters Health Primary Care Network.
Welcome to all of you to our show.
Thanks for having us.
And thank you so much for taking the time to join us. For our regular listeners, you will be aware that the purpose of Sending the Community show is to try and raise profile of all the amazing hard work that's going on in and around Luton. And if it's further afield, sometimes Raz and I will travel to try and make sure we share those good ideas and practices with our amazing diverse community here in Luton as well. And we've had a lot going on this summer in terms of disability sport. We had the Disability Celebration Month in July, and on the back of that, Raz has some amazing news to share with us about recent cricket disability presentation. Raz, do you want to tell us?
As the Best All-Rounder Trophy.
So Raz was given the Best All-Rounder Trophy at Luton Town and Indians Cricket Club on Sunday, the 21st of September, for Raz's excellent hard work in cricket throughout the season. So well done, Raz.
Congratulations.
Thank you so much. And we mentioned that because disability cricket is an integral part of our community. Lots of people have interest in sport, and for Raz it's cricket. And we started this at Luton Town Indians Cricket Club about 13 years ago, and we have gone far and wide to continue with that. And then alongside that, there are other sports and events that celebrate those opportunities, and one of those events is coming up on the 2nd of October, which Hatters Primary Care Network are going to be hosting, and we will talk a bit more about that. That's called the Learning Disability Community Event over at Hockwell Ring Community Centre on Thursday the 2nd of October from 5 to 7 p.m. Everybody is welcome, free parking, free goodie bags, light refreshments available as well, and all sorts. But before we go that far, I'd like Juliet, I'll start with you. If you could tell us a bit about your role, please. So what does your role actually entail?
Right, so as a social prescriber, we get referrals from GP or other PCN staff, or even from the community, and people can self-refer to us. But normally our referrals will be something that you can't prescribe medication for. So someone may need exercise. Jane is our lead on exercise and activities. So they may come through our system and I might say, Jane's the one for that. Or it could be we organise a coffee morning where people will come in and get patient education. We do webinars on patient education around different health topics. We can support with things like referrals to psychological therapies, signposting to groups in the community that will benefit that individual. We'll just have a conversation with them, find out what their need is, and if we haven't got an organisation for them, we will find one, or we'll even set up a group because we feel there's a need for that. So that's, the role is quite diverse. We get all sorts of referrals.
Okay, brilliant. And the key thing is that can be a self-referral.
Yeah, we can take self-referrals. When we do our drop-ins or coffee mornings, people will approach us and say, I'd really like to do this, and I'll book an appointment, a consultation with them or Jane, and then we will talk about what we can do to help them.
And thank you so much for that, Juliet. And Jane, what about your role? How does that compare with Juliet's role?
Very similar. So we do the same types of interventions and the same types of patient one-to-one work. Juliet, with her lead head on, she will help to get things, make those connections in the community and make sure that we're following up leads and developing different programs. But the roles are very similar. As Juliet alluded to, I've got a keen interest in physical activity. So anything that involves movement, ensuring that people are getting active, that's something that I aim to set up in the community. So it might be that I'm linking with some of those local services across the town that are already offering different physical activity programs or initiatives, and we look to see if we can make links with those and bring them to our PCN so that we can offer those services to our patients as well. I do some chair-based exercises and a walking group, so I'm really keen to make sure that people are getting out into the community and being as active as they can to keep healthy.
Excellent. I'd actually ask a bit about which surgeries are part of the network.
Which part of our surgery do you do?
So there are 5 surgeries that come under Hatters Health PCN. We have Hockwell Ring, Dr. Merz's, Lister House Surgery, Sundon Medical, Leagrave Surgery, and Oakley Road Surgery.
Yeah, sure. And perhaps, Jen, if you could read some of these, read out about some of the services that are going to be there, because this is an audio show that we're doing at the moment, so I appreciate our listeners might not be able to see this amazing leaflet we have in front of us.
So we've got services from Total Wellbeing coming, the Disability Resource Centre, we've got colleagues from Music 24, Healthier You, got some colleagues from, I'm just having a look, from Xyla, which is a diabetes programme. I can't see my other
Say the Disability Resource Centre.
Yeah.
Who else has come in?
The Bedfordshire Fire and Rescue Service.
Yeah, they come in and they do home safety checks. So anyone that comes along that wants one, they can organise that. But they also have a house that is built with lots of hazards. So on the day, patients who might want to come along to see that house, they'll invite them in, and that could be anyone who lives independently or lives with family members. But there are hazards in houses that you're not aware of. But it could be like putting your curling tongs on a bed and starting a fire, or it could be, broken bottles or plug sockets next to water. There's so many hazards in the house that we might not even know ourselves, but somebody who has maybe a learning disability, they might not identify that as a hazard. So that's a really good service to get involved with on that day.
Excellent. So listeners, if you just tuned in, you're listening to The Send in the Community with me, Hafiz Muhammad Umar. It is a pre-record that we are playing, and today I am delighted to have Raz with me here. Hi again, Raz.
Hi.
And also have Jane and Juliet from the Hatters Healthy Primary Care Network, and we are talking about the amazing work they are doing in the community. And at the moment we're just focusing on the Learning Disability Community event, which is planned for Thursday the 2nd of October 2025 over at Hockwell Ring Community Centre from 5 to 7 in the evening. And Jane and Juliet were very kindly going through some of the amazing groups that are going to be present. This is also in collaboration with Medics and Oasis PCNs, 2 other amazing local PCNs that are working here. And for those of you that have been using the GP services, you may or may not be aware that I think all of the local GP services are now assigned to a primary care network. I wasn't aware of this until a few months ago, the fact that that's how it's happened. And when you're coming across names like, Hatters or Oasis or Medics or Equality or Phoenix or what have you, actually that means something. And if you are used to children in schools, it almost can be categorized like these multi-academy trusts that have come in to work with a number of schools that are under one umbrella. So that's the little analogy I try to use. Oh, children learning trust. Yes, the Shawnees, the Denbys, and what have you. They don't want, and then the shared learning trust. You go Stockwood, etc. I think the key benefit here is that you've got a number of different services under one umbrella of a GP services, and we were talking earlier about the roles that Jane and Juliet play in supporting and signposting people. So you're both here, which is amazing. What other professionals are within your wider team then, with different roles?
So we have pharmacists, pharmacy technicians. We have a hub in 10th Avenue, Sundon Park, and we'll have physiotherapists in there, GP,
care coordinators.
The clinical care coordinators, they have their own clinics. Emma, who would have been here today, who's organised this, she has a clinic for patients who are due to have their learning, who have learning disabilities, who should have their reviews. So we do struggle to get everybody turning up for their reviews. So she has organised this to create awareness about that. But we have
nurses, nurse practitioners, health coach.
Yeah. And I think part of the reason why we try to highlight the excellence of the services you provide is to make a community aware that a GP surgery is far more than just seeing the doctor when you're unwell. As you quite rightly mentioned, there is so much more available there, and for people to feel more empowered and more confident in asking for greater services. And one area you just mentioned there was around the annual reviews for people with disabilities. Raz, you had your one recently, do you remember?
Yes.
And how was that for you when you went in?
Good.
And did you have to wait for too long to see the doctor?
No.
And was the doctor kind towards you?
Yes.
Did they speak to you or did they speak to me?
Yes, speak to me.
Yeah, and that was quite nice because we had a very positive experience at our surgery. Our surgery is amazing. The doctors know Raz very well, they understand his needs, and I think one of the things that works well for us and we appreciate is when they try to talk directly to the person with disabilities rather than talk about them. And we appreciate as a family sometimes, whereas I will use as an example my younger brother, if he's unable to express himself, then the doctors will allow either myself or my mum or one of my siblings to step in and speak on his behalf to elaborate on a particular difficulty he might be having. But those annual reviews are so crucial, and I'm so pleased Amma is leading the way on ensuring more and more people with disabilities are encouraged to get their annual health checks done, because that can then open many more doors for them as well, and particularly if a condition starts as a new thing, and then that can easily escalate quite quickly if that isn't addressed at the earlier stage. So what kind of adjustments, I'll ask both of you if you can answer this, what reasonable adjustments do you expect the GP services within your network to make for people like us with disabilities?
Oh, our building is easily accessible, and the good thing about being part of a network is if you can't make it to one surgery, we can get you an appointment at another surgery that isn't your surgery. And at the hub, we can see patients from any of those surgeries. And as I said, it's easy access into the building. We can do home visits if people are unable to come out. And that could be blood tests have been done at home. I feel we are a service that we will make whatever the adjustments are to accommodate patients.
We also do something called enhanced access, so we offer appointments outside of what you'd call your standard week. So we offer appointments on a Saturday, and I'm aware of one of our patients. Her child is unable. She boards all week at school, so she would be an example of somebody that wouldn't potentially be able to get to those appointments during the week. So we're able to offer those appointments on a weekend, and I certainly know that our care coordinators do offer those appointments for the reviews and blood tests and things on a weekend.
And we will offer telephone appointments, but obviously it's often better to see somebody face to face. You can pick up a lot more in that session.
And what about people who might have anxieties around the waiting? I'm thinking, if I go to the doctor's, my appointment at, I don't know, 11 o'clock, will I need to wait for half an hour, 40 minutes before I'm seeing? Or do you make sure those individuals that come in with added needs are seen as close as possible to their allocated time?
If we're aware of that, we would definitely put measures in place. The same as if somebody speaks another language, we'll make sure that there's support there or an interpreter service available. We would identify some of those needs before the appointment, particularly with this group of patients, because a lot of times we could send a text out and we don't know that text has been received, so we would be making telephone calls to book people in.
And I guess the other question that then comes to mind is getting to the surgery. I assume there would be some kind of parking available, and if people are using public transport, are there bus stops nearby?
Yeah, there's a bus stop not too far from us. We do have very limited parking. There is parking available, but even as staff, we may have to double park, lock each other in. But generally, you do get a space. There are lots of side roads with off-road parking. Not off-road.
With parking facilities available.
And there's shops just around the corner that's got plenty of parking.
Excellent. And you mentioned the possibility of getting a translator in for people who might not have English as a first language or might not speak English fluently enough to be able to understand all the different medical terminology, etc. How does that offer work? Do patients need to let you know at the time of registration or when they are booking an appointment that they would need an interpreter? Does that work?
It should show on your patient records if English is not your first language. But also, if the appointment's been booked by telephone, there's certain questions you'd ask, and someone might say, "Could you speak to a family member? I don't speak English," and then we can invite the family member to the appointment, but we can't assume everybody wants their family at those appointments. But it's usually identified from the patient record.
And if it isn't, then you can make the staff aware when you book the appointment that an interpreter will be needed.
And then I guess another barrier that has come to light at the back of the standing report is the need to make sure cultural needs are met. And some of those cultural needs are, I guess, the universal needs. For example, a female patient wanting to be seen by a female doctor only. That could be any one of our mothers, daughters, sisters, whoever. Do the GP services under your network provide those kind of facilities?
Yeah, we definitely offer that. We also would offer a chaperone if they felt like they can see a male, but they would rather have a female there as well. But on 2 Saturdays ago, we did an all-women's clinic, and we had all the staff on the day was female, so the GP was female. We promoted it for women who may possibly just want to come into the building, and unfortunately we had people turn up with their husbands. We would have to say, sorry, do you mind waiting outside? But they understood.
Yes,
we tried to do the day aimed at making women feel comfortable and know they're going to see a female. But definitely we would accommodate appointments like that.
Excellent. And once somebody has been in, and we will start unpicking some of these amazing services that you offer. So say somebody came in with a blood pressure, as we were talking about earlier, just a general check, whether it's at your event or they came to the surgery, and you notice some abnormality, and they are a patient registered at one of your GPs. What can they expect to happen next from there?
Okay, so we don't do the blood pressures only because we're not clinical. We tend to organise the events and invite people in, and then we'll have the clinical care coordinators and the staff doing the blood pressure. But if we're aware of it, we will go onto the patient's record, send a message to the patient's GP practice, and we would also encourage the patient to go into their practice. It will be recorded on their record that the blood pressure is high, and we would suggest they have a follow-up of that. We're not going to leave them to go away, and people can refuse, because we've been at events where people have said, we've said you need to go to A&E, and they've said they're not going, but we will also record that on the patient's record.
That was their preference.
Yeah.
You have made the recommendation, and I think, listeners, that is part of the reason why we are raising awareness of what's happening in the community. If you are advised to go and get yourself checked by your doctor or to the A&E, please follow that through. Sometimes there might be nothing to worry about. On the other hand, it could be something quite tricky that needs addressing at the earliest stage. So please do not ignore that advice, especially when it's coming from the medical professionals. And then I'll just read out some of the additional services that you offer, and after the break we will elaborate on those a bit more. So, in alphabetical order, I think this is in cancer services, dementia, diabetes, enhanced access. That sounds quite interesting. We'll have a good discussion around that. And then enhanced health in care homes, health and well-being, medication review, mental health, musculoskeletal, social prescription, and then the vaccinations, which are quite important. And we are approaching a break very, very shortly, in the next couple of minutes or so. And before we go to that, I'll ask you both just to sort of summarize what we've discussed so far in this first half of the show. Got just under a minute each to try and do that. Start with you, Jane, and then I'll move on to you, Juliet.
Thank you. So I'd like to just remind you that the event is happening on the 2nd of October. So that's for our learning disability patients and their families to come along between 5 and 7 o'clock at Hockwell Community Centre. You will have an opportunity to speak to different services that are there on the day. You'll have the opportunity to have your blood pressure taken, blood sugars reviewed, and take part in some physical activity if you choose. There's free parking, there's refreshments available, and there'll be somebody you can talk to about weight and diet and lifestyle and all the different services that are available to you across the community. So that's my reminder to come along to our event. Juliet?
Oh, Jane said so much, I don't know what to say now. But what I would say is we do lots of different events in the community. Our aim is to create health awareness. Everyone is welcome to all our events. The importance of coming for your health check is to identify any new issues. You could have gone 2 years without having your bloods checked, and if you are diabetic, we know that diabetes can get out of control if it's not picked up early. So it's just good to have that health check so we can see if there's any measures that need to be put in place.
Yeah. Brilliant. Thank you so much, Raz. What do you reckon? Shall we go to this then?
Yeah, I reckon.
It's on Thursday, the 2nd of October, Hockwell Community Centre, 5 till 7 o'clock in the evening. So do you mind getting your blood checked on the day, Raz?
Yeah, no.
You don't mind at all? Excellent. So, listeners, we are heading off to a short break now, and when you come back, do remember to tune in again, please, because we will continue this discussion around the services that the Hatters Primary Care Network provides in and around Luton. Wassalamu alaikum wa rahmatullahi wa barakatuh. Bismillah, walhamdulillah, wassalatu wassalamu ala rasulillah, amma ba'd. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the second half of tonight's Sunday the Community Show with me, Hafiz Muhammad Umar. And if you were with us before the break, you will know that in tonight's show we are talking with some amazing guests from the Hatters Health Network is a primary care network based here in Luton, consists of 5 local GP surgeries, and it is a network similar to some of the others we had on the show before, like Equality and Phoenix. And today it is a pre-recorded show, and I'm delighted to be joined by our amazing Raz. Assalamu alaikum. So Raz, my younger brother, he is with us, and we also have Juliet. Hi, Juliet.
Hi.
Just remind our listeners of your role again, please, Juliet.
I'm lead social prescriber at Hatters Health Primary Care Network.
Thank you so much. And Jane, please.
Hello, I'm Jane, and I'm social prescriber at Hatters as well.
Brilliant. Thank you so much for joining us, ladies. So, before we go any further, there is a really exciting event coming up, which Hatters Primary Care Network have organised in collaboration with Medics and Oasis Primary Care Networks in Luton. It is taking place on Thursday, the 2nd of October 2025 at Hockwell Community Centre from 5 till 7 o'clock in the evening. There'll be lots of exciting things happening on the evening. It is free to attend, free parking, free goodie bags, light refreshments. You get an opportunity to have your blood pressure measured, and also lots of help, support, advice around accessing health services in and around Luton. It is predominantly for the surgeries that under those 3 PCNs, but anybody can attend. The main focus is reaching out for the disability community within Luton and surrounding areas, and if you feel as though your own GP surgery is not under one of those, you can still attend, and you can get signposted for more support if you need to, because these primary care networks are amazing and they work very, very closely. So please make your way to Hockwell Community Centre on Thursday the 2nd of October from 5 to 7 in the evening. So continuing with our conversation from before the break, the ladies, we were talking about different services. We managed to talk a bit about the blood pressure and the pathways around that, and then what about, I mean, this is quite a scary word for a lot of people, and quite rightly so as well, and there are lots of anxieties around it. It's around cancer. How do the surgeries within your primary care network initially carry out any kind of possible checks around somebody who might be concerned or might suspect they might carry symptoms that might lead to cancer, and what kind of support is available?
So as a whole primary care network, we're keen to promote the participation in cancer screening and the programs that are associated with those that can help identify cancers early on. And obviously that's a key part of making sure that your cancer is not only identified but treated. So there are lots of different screening programs that take place, and there's information on the Hatters Health website that can direct you to where you might need to go for that, and at what age and what eligibility applies to you at that time. As a health and wellbeing team, we also do events that might encourage, if you're for example, we did a women's health event just recently, where women were invited in to have cervical smear tests. So we might do events that encourage a certain group of patients to come along and make sure that they're accessing those tests if they're due. Did you have anything to
Yeah, we've done events around prostate screening and encouraged people to come in and get information, advice, and then once they've come in, we will send them off for the screening.
Yeah, and as you mentioned, Jane, there is a lot on the website as well. So if you go to hattershealthnetwork.co.uk and look under services and then cancer, there are short videos that you could watch as well on how the breast screening process works, for example, what age groups, as Jane mentioned earlier, are targeted in particular. But I'm sure if anybody else has any cause for concern, please do not feel you're isolated or alone. Speak to your GP. The services there are incredibly supportive, and get yourself checked. Likewise, there's a short video around cervical cancer as well, and prostate cancer you mentioned, Juliet, also. I guess the key thing is doing something about anything that you suspect, rather than thinking, oh, it will just go away, it will disappear. It might be nothing, but you'd rather have the reassurances than to assume it's nothing, and then by the time you go and get some professional support, you don't want it to be too late. So I guess the earliest opportunity you get to get tested is so important. And then, Juliet, if you move down towards dementia, then please, and support for those who might be expressing early signs or symptoms of dementia, and what kind of help or support could be available for them.
Right, so we have a clinic which one of our clinical care coordinators run with the Admiral Nurse of Luton, who is a specialist on dementia, and I believe she's the only one in the country.
Wow.
So we're very lucky to have her. And at those clinics, they will we can refer people in. Anyone in the PCN can refer people to be reviewed if there is a suspicion that there's a change in the person's behaviour, or their memory is going, or could be they've become confused. The family can refer into them, and then they will do a memory assessment, and if it's identified that they do have dementia, they could then have a care package put in place, and it helps the family and the individual to manage everyday living. We also work closely with the Alzheimer's Society. We refer into them, and they have different groups where people can come together and as carers or the individual and have support and engage in different activities, like Music 24, who I believe they're coming on the day. They do a lot with the dementia patients as well, and it keeps people, music helps everybody. It doesn't need to, you don't have to be from any particular background. It's something that connects people together, and we notice that it does wonders for people with dementia.
Absolutely, and our listeners might recall we had Music 24 on the show a few months ago, and we talked in depth about the amazing services they provide for the whole community, but particularly for those with dementia, and that is something that I think is highly celebrated throughout the town. And then, Jane, diabetes. If anybody is concerned about diabetes, what should they do?
Well, if you've been diagnosed as having diabetes, or you're at a stage where you have pre-diabetes, so it's before you're diagnosed with diabetes, then it's important to speak to one of your healthcare professionals, the GP or the nurse. If you are somebody that's living with diabetes, then you're usually invited in for a review. So it's really important that you attend those reviews. And as we mentioned before, there's lots of opportunities to do that. There's evening appointments and weekend appointments. And if you're somebody that perhaps is in the pre-diabetes stage, and you're thinking about how you would like to make changes to prevent it, potentially prevent it progressing on to diabetes, then again, that's something you can speak to your GP or healthcare professional about. It's very likely that they might suggest you speak to a social prescriber, for instance, who can signpost you or refer you, or suggest different activities and lifestyle changes that you can be making, which would help to bring some of those levels of that are leading towards that diabetes, that help bring some of those levels down. So yes, come in for your diabetes review. That's really important. Make sure that you're getting everything checked, but also speak to your GP about how you can work with the wider professionals to perhaps change lifestyle factors that might be affecting that diabetes. Pre-diabetes.
Yeah, and Juliet, what can people expect from a diabetes review then? So once they've been diagnosed with diabetes, what can they expect?
So we would be checking their bloods and identifying if it's getting better or worse, and if they are on tablet form, metformin, then they may be able to reverse diabetes by those lifestyle changes that they make in terms of their eating habits. That's the sort of thing we'd be talking to them about. They could end up coming off of the medication altogether, but if they're not controlling it by following their care plan or the suggestions, they could then end up on insulin, and the insulin could then be adjusted according to when the blood sugar readings are submitted, and sometimes it could be higher at a certain time of day, so then you could look at what did they eat before that, and they'll have a plan to monitor. Home monitoring is important, just to identify the worst time of day and what adjustments need to be made. But diabetes is reversible, so it's important to follow a plan if you've been identified, especially if you're pre-diabetic, because then you don't need to end up on medication.
Yep. Thank you so much. Listeners, if you just tuned in, you're listening to Stand in the Community with me, Hafiz Muhammad Umar, and in today's show we are talking about primary care networks, particularly Hatter's Health Network based here in Luton, and with me are Jane and Juliet from Hatter's Health Network, and also my younger brother Raz. Hi again, Raz. And we are going to talk a little bit now about physical activity and its significance for people with young people and adults with learning disabilities. Raz, tell us a bit about the activities you do. So you told us about cricket already. What else do you do?
Boxing.
You do boxing.
Wow.
Excellent. When do you do boxing?
Wednesday and Saturday.
What times?
Wednesday's at 5:30 to 7:30. Saturday's 9:30 to 11:30.
And where is that? Where does that take place?
Cholan Centre.
Cholan Community Centre on Dunstable Road in Luton.
Yes.
Brilliant. And what else do you do apart from your disability? Cricket, boxing, when it comes to leisure activities, what do you do?
I just recite some Arabic Nasheeds of the Islamic
When you do your sabak, you mean?
Yeah. Sabak.
Okay. And what about going to places? What kind of places do you like going to in your free time?
Sometimes I go to Friday, etc. I come for a special play for a Jummah.
And also, when you need to get things for home, for shopping, what do you do?
I just go for tea.
Yep, sometimes you go shopping. Where do you do that?
Whenever
I need something, like, okay. And what about things like bowling? Do you like doing bowling?
Yeah.
It's a leisure activity. Yeah, brilliant. So that's the sort of thing that Raz does. Ladies, for people like Raz, would you encourage physical activity? Would you encourage people to get into and more involved with what's happening in the local area? What are the opportunities out there at the moment?
I'm going to let Jane talk about activities in the local area, but I thought it'd be really good if Raz came along to our event and encouraged other people to join in some of those activities,
would you like
the boxing and the cricket. That would
excellent.
be a really
Thank
good.
you. Thank you so much. I can arrange something.
Example.
Sure.
Yeah.
Brilliant.
Yeah, it would be good to have you come along because there will be some activities, physical activities, Raz, taking place on the day. So it would be good to have you there and helping me do some of those. And you sound really active, which is great. It's really great. I can't encourage anything else for you because you're already doing so much. And I guess for us, it's really important to make sure that everybody is doing some kind of movement every day. And we hear lots of people say that they can't, they're not able to, for various different health reasons or well-being reasons. And I think that the misconception is that people feel they've got to go to a gym, they've got to do something really hard and fast, and that's not necessarily true. So the key takeaway for me is that you're doing some sort of movement every day, and that can be something, as you already said, bowling, doing some, going off to do the shopping, so you're doing some walking, you're doing some lifting with the shopping, so this is all form of physical activity. So that's really important for me. On a Tuesday, fortnightly, I do a walking group, and that's under the Ramblers walking group umbrella, so and we're keen to have anybody attend that. We have our patients there, but we have people that are not our patients, so that's a nice sort of 2-mile walk, and it's suitable for any ability. So that's something I think walking is a great exercise that's free. People can be doing that every day, and we are doing some chair-based exercise sessions. We've just finished some with our local church, and we're looking at doing some at the Luton Town Football Club. So there's opportunities there again for people to come along, and possibly doing some within the Shantona Ladies Group in Hockwell Ring as well. So there's different activities there. And I forgot the question.
We were just talking about different physical activities for people with disabilities in and around town.
Yeah, so in terms of physical activities that are specifically designed to encourage people with learning disabilities into the community, that's something that I'm not too familiar with, but I think if you come along on the day, you'll be speaking to the services that we have there, who will have a long list of activities, and also trips and things that get planned across the town that are actually aimed to get people out and about and doing things.
Wonderful. And on that note, I would also remind our listeners of the local offer on Luton Borough Council's website. Sarah Maffrey is the contact, and she's absolutely amazing. She joined the team, I think, around this time last year, and she's really done a lot of work around revamping the website, making it more accessible, more dyslexia friendly for people who have difficulty reading. There is a computer reader available as well, and there is a whole host of services that are listed there under one umbrella for young people, for adults, for anybody with any kind of added need, and that covers all aspects, not just your leisurely activities, your health, care, education. It's an all-rounded website, and it's ever growing as well. Sarah's very approachable. If you want to get in touch with her, she's happy for me to share her email. Is sarah.maffrey, MAFFRE @luton.gov.uk, and I'm sure she'll be more than happy to hear from amazing young people, and we will certainly share that with our guests here as well today.
She's coming on the Thursday.
She'll be there as well.
Yes, so that's the kind of what I'm alluding to. If you're available, you can come along to our event. Sarah will be there with her team, and she'll be able to provide much more information about all the different activities that are taking place across the town, and there are many.
We work really closely with Sarah. As you say, she's very approachable. She's good at what she does, and we're always engaging to work together.
Brilliant. And we will, I guess the next point we've pretty much covered already, enhanced access. We talked earlier about how GP services can be accessed at different times depending on individuals' needs. If people are tied up during the day, for example, or have difficulties in accessing transport to get to the GP appointment, let the GP service know that you have an added need, and they will make adjustments around your needs as well. So we've, I think, pretty much covered enhanced access already, and I guess the only point to add to that is enhanced health in care homes. So if somebody is in a care home, what kind of support can they expect?
Well, we have our clinical care coordinators who if you want to touch on that one, they will touch base with the care homes on a weekly basis. They have like an MDT meeting. If the care home has a patient that they feel needs a little bit more input, they'll raise that patient at the MDT meeting, and it could be things around trying to get funding to get a wheelchair. It could be that their family member might need a little bit more support to help out in that situation. We would bring them into our MDT meetings to look at what holistic measures could be put in place, and if there's anything around cognitive impairment that we need to be looking at. It's really just an assessment of each individual. I mean, they're pretty much looked after in a care home, but there are additional things that may come up, and we would be supporting Catpole Grange, Mulberry Court, Oakley Lodge and Collinson House.
Brilliant.
And that's where our care coordinators would be supporting.
Thank you so much, Juliet. And Jane, moving on to health and wellbeing resources. What kind of support could people expect if they're patient at one of your surgeries?
Everything really, Mohammed. But as we're part of the health and wellbeing team, Juliet and I, and our colleague Emma. So we work. That's our area. So if a patient was to go to their GP or a different healthcare professional, and they spoke about something that perhaps wasn't medical, so it could be something affecting their social, emotional, or physical needs. And when I say social, it could be things like finances. They might need some information about how to access some housing advice. Debt advice, anything that's not medical. So if they spoke to their GP about something like that, and their GP would likely refer them over to the health and wellbeing team, and that's where one of us would contact the patient and have a consultation with them to find out exactly what it was that they might be needing support with, and then it's from that conversation that we'll develop a plan with them. So it might be that we do referrals into different services that can give them specialised support and guidance. It might be that we give them signposting information. It really is a long list of different things, but it's anything that wouldn't be medical usually, and outside of that perimeter is anything that we can support them with.
Absolutely, and thank you so much for mentioning that as well, because I think a lot of the times people don't realise the root cause of their anxiety or depression, and as you said quite rightly, if it's something to do with that, one common factor, at the moment with the high rise in cost of living, for example, and if somebody, God forbid, is in a situation where their employer is going bust and they are not going to be having a job in the near future, that can cause all kind of worries. And alongside what Jane you were mentioning there, I guess you'd be able to advise on benefits as well. And I know of some families within the community who have never claimed any benefits in their lives. They've all their lives, all they've known is you work, you get paid, your life carries on, and suddenly you're in that situation, and then there's that element of embarrassment. I do not want to be depending on benefits. I actually want to be earning, and whilst that is highly commendable, in some situations you've got to be able to prepared to get the support that is rightly entitled to yourself. And sometimes what I say to people is all those taxes you've been paying actually contribute towards these kind of situations where you can be supported at your hour of need, and that's your hour of need to be able to move forward.
For sure. And if somebody is experiencing financial difficulty for whatever reason, and that's impacting their health and well-being, then it's important that they do raise that with somebody. We don't provide that support around the debt and finances, but what we definitely do is refer you to our colleagues that we work really closely with, and it might be within citizens advice, it might be within carers support services, it might be that we give them signposting information to appropriate teams within the council. It might be that there's support needed for fuel poverty, for example. We work with so many of those services, and are usually have that information to be able to do a direct referral for them. So it's important that they just bring that to light so that we can talk about the right route for them.
Absolutely. And then, we have touched on mental health, and mental health is such a huge area that we just would not be able to do justice to it within a minute or two of what's remaining of this show, and there is so much still to talk about. And I'll go over to you, Jane, and I'll ask you a bit about musculoskeletal services within your organisation, please. How does that work?
Oh, I'll speak a bit.
And Juliet, sorry.
Yeah. So we have the physiotherapist based in our 10th Avenue building, so we can book patients directly in to see them. It's the first point of contact physio, so that it will be quite a quick appointment, and if they feel that they haven't been able to manage that, whatever the pain is or whatever they've gone to that appointment for, they'll give them a plan, an exercise plan, but they will also refer them on to the main physiotherapist, and it's a quicker route in, which has been really helpful for us, because the patient could come and see me today and they've said, oh, my back's been aching, I can't do this. Because of it, it's prevented me from being able to get back to work. We've got a couple of things in the building where we would say, well, we can get you back into work with help from our employment advisors, but we can also get you in to see the physiotherapist to identify if this is something more than just you pulled a muscle, or they'll do an assessment of that person. But it's really helpful to us to have them there in our building.
Yep. Brilliant. We are coming to the end of the show now. Last about 20 seconds or so to you, Jane, if you could just remind our listeners about this amazing event you've got coming up and why they should attend it, please.
Okay, please come along to our Learning Disability event at Hockwell Community Centre on Thursday the 2nd of October between 5 o'clock and 7 o'clock in the evening. Opportunity to have a blood pressure check, speak to a range of different healthcare professionals or services from across the town. The fire service will be there offering tips and information about their support. As you mentioned, Sarah Maffrey will be talking about the local offer. You might engage in some chair-based exercise on the day.
Thank you so much. My guest today, Jane, Juliet from Actors Healthcare Network and Braz. Thank you so much for joining us. Listeners, it's been a pleasure having you again with us, and do tune in next